Guthrie of Kentucky for his 5 minutes.
Thank you, and I thank you all for being here today. So for Mr. Toy and Dr. Ibrahim, Clover and Viz.ai have both launched successful AI technologies in healthcare. Speaking from your company's own experience, so I'll start with Mr. Toy and then speaking from your company's experience, how can AI tools be leveraged to empower and not replace providers in ways that can help them better manage and deliver care?
Thank you for the question. I think the key here is, as we've all said, that the physicians in question need to be able to feel like that they are able to do their jobs better than they were before, that the friction is being lowered, and that they are feeling effectively empowered to do a better job. There should be a force multiplier that comes from AI. So what they were going to do perhaps anyway, they can do faster, quicker, and easier, including getting reimbursed for that treatment. So I think that AI we're showing in our own plan is already doing that with our tool, Clover Assistant. We're putting that in the hands of primary care physicians who are diagnosing diabetes earlier, who are managing chronic kidney disease earlier, and that's by synthesizing that data and putting it at their fingertips.
Thank you. Dr. Ibrahim?
And I'll just add to that, and I'll maybe just give perspective from my own practice. I have a clinic every Tuesday afternoon where I may see a dozen new patients, and Monday night I spend 2 or 3 hours to read about them, because to get the 3 or 4 data points that I need to make a decision about their care, I log into 3 or 4 different places. I read through scanned PDFs from an outside hospital to try to piece the whole story together. And I know many of my colleagues do the same thing, including for time-sensitive things in the hospital. To harness our technology, and it's one of the things we've done in our company, to help find that information quicker so that the physician can get to what they want to do, is make a treatment plan for that patient, may be one of the most valuable contributions of AI.
Okay, so follow-up for the two of you as well. How should policymakers think about ensuring more of these innovations can reach patients and clinicians without overburdensome regulations getting in the way? And we balance the need. How do we balance the need between the appropriate guardrails and patient safety and getting these deployed?
I'll take that first. Thank you for that question as well. I think that the way we consider it is by having that clinician being accelerated by the AI, knowing that that clinician is available to review its recommendations, that serves as an important guardrail in and of itself. And so that we are accelerating what's in their own mind. We are relying on the training that they have. We're just making their job easier. So anytime we're making that, expanding the possibilities of how we do that with a clinician, a physician, we feel like we're in a pretty good place from a guardrail perspective.
Thank you, Chairman, and I'll maybe connect my answer to the ranking member Deget's previous comment. I have a lot of empathy and sympathy for the FDA at the moment, where they're being asked to evaluate a new technology that they're not really designed to evaluate right now. They're using laws that are decades old, or statutes or authorities or frameworks that don't really fit the pace or the way that AI is being used. So support from Congress that would help FDA modernize, whether it's another version of 21st century cures or something similar, would be helpful so that the FDA can efficiently figure out which of these products are snake oil and should not be approved, and which of these are approved, and once they're approved, they can then be supported through reimbursement. So I think there's some tangible policy there that would be incredibly helpful.
Okay, thank you. And so, Mr. Parker, this committee in the Trump administration has made healthcare price transparency a top priority. It's bipartisan. How are price transparency and reporting policies enabling your company to empower American patients in their healthcare journey? And can you discuss the role AI plays enabling general medicine to do this work?
Yeah, I should state very clearly that the work we're doing to show consumers prices up front for procedures, labs, imaging, anything that they need would not be possible without all of that work. We are using the open pricing files to figure out the sort of reimbursement and their specific pricing for the consumer, but it really also wouldn't be possible without AI. You know, the example I shared in the testimony is we're literally taking down your full 100-page coverage of benefits and using AI to read those coverage of benefits and turn it into useful data, and then munging that together with the open pricing files to give patients a clear out-of-pocket price. So it really is a byproduct of all the work that's been done over the last decade to require providers to disclose these pricing files.
And so to the providers, insurance companies, whatever PBMs, you have to have the price data publicly available for AI to be able to call out and give people the best answer.
That is correct. Yep.
Because if it's hidden data, then AI is not going to find it.
Yep.
Right. Thank you, and I yield back.